Thank you, Yolanda. And now we'll turn to Susan Borja from the National Institute of Mental Health.
Thank you. Happy to be here with everybody and round out this fantastic group of colleagues from across NIH. So I am from the National Institute of Mental Health, and when we've been thinking about responding to this pandemic, in the early days, we originally were anticipating there being a surge in mental health needs. We were not considering, I think, that it would go on quite as long as where we are right now, but we anticipated that just the simple stressors of what was happening could be exacerbating mental health conditions for people. So when we think about who are we talking about with mental illness and COVID, there are three broad populations that might be considered. The first is the incident illness following infection with SARS-CoV-2. Dr. Korsh had started us off lovely by providing some background on how that might occur with viral load and blood-brain barriers and such. And what we're seeing so far is that among people with the infection with the virus, we do see new incident mental illness. There's a fantastic paper out from a group that were published in Lancet where we see rates that increase of anxiety, depression, primarily. We don't see an increase in schizophrenia. We don't see an increase in some other areas. That response mimics a lot of what we see oftentimes after a disaster, or people that are infected with, or not infected, but have other major health events, cancers or heart attacks. So right now, I think we don't know what the mental health impact will be from viral infection per se versus the psychological consequences that go along with that. The second is the social, behavioral, and economic impacts that you're hearing a lot of people refer to, that this has had widespread disruption for life as we knew it. And so we anticipate that there will continue to be reverberating consequences, not just in this acute phase, but for some enduring time period. Then we also consider the people that already had existing mental health conditions that may have disruptions or shifts in their delivery of care as we've had to shift how we do everything with this pandemic, and what has been the impact on them. So those have been our primary areas where we've invested, is that second two categories. And so you could look up in Reporter to see what's already been funded, similar to other institutes. This has primarily been through supplements to very quickly respond, but we've also been starting to see original applications come in as well. At this time, the available funding announcements you've heard mentioned a couple of times is an R01 for digital health interventions. This has one more receipt date of March 2nd. These require that you have a partnership with digital health developers or platforms to really rapidly scale and test digital health interventions. It's not simply to take something that you could do in person. Now we're just going to see if we can do it via telehealth, but really to respond to the public health needs. And NIMH is also still receiving applications through a program announcement for emergency supplements. These don't have to be related to the original aims of a funded award, but would be responding to the pandemic. And we're increasingly seeing folks submitting with parent announcements, original application ideas, and we would encourage you to talk with your program officer. And I know we have a bunch of questions, so I don't want to hold us up any longer getting to those, so I'm going to turn it back over to our moderators. Thanks.